Hey everyone, here's a quick demo of how the OP consultation flow works in care. First, I'm going to quickly sign in as a doctor to show you how a doctor sets up their schedule for appointments. I'm a doctor at the Mysore Medical College, and I can see that I have set up my schedules over here for OP evening scheduling from 2 p.m. to 4 p.m. and I have 12 slots of 10 minutes each in which patients can be coming in. I can create more number of templates for a different time range. I can set up appointments with a specific start time and end time with n number of slots which I can specify. I can add more sessions as well, maybe a morning and evening session, etc. And at the same time, I can also mark exceptions for when I'm not available. For instance, if I'm on leave or traveling or not available for any other reason, I can say that, hey, from the 3rd to the 6th, I am fully unavailable, and that works just fine. Now I'm going to quickly log out as the doctor, and I'm going to assume that I'm a patient who wants to schedule a new appointment with the doctor in Mysore. So I'm going to select that I want to see all the hospitals in Mysore, open up Mysore Medical College, and I can see that the doctor is available. I'm going to use my phone number to verify myself, and I'm going to use my OTP to log in and say that, hey, I want an appointment at 7:30 in the evening. I'm going to click on continue, and I already have a patient record over here, and if I am a different patient, I can do that as well. I'm going to go ahead and confirm an appointment. I can also log in to my patient dashboard and take a look at all of the appointments I have already scheduled and my historic list of appointments. So this is the appointment that I've just created, which has a status booked, and I have a history of appointments here as well from previous dates. Now let's quickly log in as a doctor to show you the entire flow from the reception all the way to discharge. So I can jump in over here and see all of the different appointments that I have. My current appointment is 91. So I'm going to click on that appointment, and as soon as the patient comes in at the reception, I'll be able to check in the patient and also go ahead and add the encounter for the patient to mark that the patient has entered the facility for a outpatient planned routine care. I'm gonna put it under the cardiology department and create the encounter. Now when the patient enters the consultation room, the doctor will be able to see that, hey, this is the new appointment for the patient for which the encounter has been created, and the doctor will be able to quickly open up the encounter and add all of the details. I can quickly come here and I can select any number of questionnaires that I want to regarding the patient. I'm going to create a consultation questionnaire. I could also add more questionnaires like blood sugar level that I want to put in, or any other details that I want to put in. I'm going to use my voice autofill to fill in all of the details of the patient. The patient has blood pressure 120/90, respiratory rate is 20. Respiratory sounds are normal and heart sounds are normal. Heart rate is 72, temperature is 95. The patient has had clinical history of sneezing and cough over the last 2 weeks. Examination shows that the patient does have a bit of congestion on their lungs. The patient has been experiencing symptoms of fever as well as cough. The patient's current diagnosis is pneumonia, and I'm advising the patient to take paracetamol, and I'm not recommending an admission, but I am recommending a follow-up advice to visit again after 2 weeks. So I'm going to stop recording over here, and the Copilot is going to transcribe the entire text of what I talked about and put it into the relevant fields over here. So the Copilot is now thinking, and hey, here we have the entire list of details that it's going to be pre-filling. I can quickly accept all of those details, and if I want to edit any of these details over here, I can do that as well. I'm gonna just add another medicine over here. I'm gonna say that it should be 150 mg with via oral route, and I'm gonna select the method for it. I'm just gonna select the site for it because the FHIR medication request requires that, and I'm gonna just jump in and save it. And there we have it, the entire encounter of the patient. I can jump into the list of medications here, print out the medication statement for the patient or for the sake of the pharmacy, and come back, and I can also update the encounter and mark that hey, the consultation has been completed and the patient is discharged.